Welcome. Today, we're diving into a condition that can silently steal your hearing and balance: ototoxicity. It's a serious issue often overlooked, but understanding it can be the first step in protecting yourself and your loved ones. Ototoxicity at its core is hearing or balance damage caused by medications or chemicals. A wide range of substances can be culprits, including certain antibiotics like aminoglycosides, chemotherapy drugs like cisplatin, high doses of aspirin or NSAIDs, and even some diuretics. These substances can damage the delicate structures of the inner ear, leading to potentially irreversible problems. It's important to remember that individual susceptibility varies. What might be safe for one person could be harmful to another. The inner ear houses the cochlea, responsible for hearing, and the vestibular system, responsible for balance. Ototoxic substances can enter these structures through the bloodstream and damage the delicate hair cells within. These hair cells are responsible for converting sound vibrations into electrical signals that the brain interprets as sound, and for sensing movement for balance. Damage to these cells disrupts this process, leading to hearing loss, tinnitus, that ringing in the ears, and balance problems like vertigo. Ototoxicity's exact prevalence is difficult to determine, as it often goes undiagnosed or is attributed to other causes of hearing loss. However, it's estimated that millions of people are exposed to potentially ototoxic medications each year. Individuals receiving long-term or high-dose treatments with known ototoxic drugs, those with pre-existing hearing loss or kidney problems, and the elderly are at a higher risk. Infants, especially premature ones treated with certain antibiotics, are also vulnerable. The signs and symptoms of ototoxicity can be subtle at first, often developing gradually. The most common symptom is hearing loss, which may initially affect high-frequency sounds. Other symptoms include tinnitus, described as ringing, buzzing, or hissing in the ears; vertigo, a sensation of spinning or dizziness, and difficulty with balance and coordination. Some people might experience oscillopsia, a visual disturbance where objects appear to be moving or bouncing. It's crucial to report any new or worsening auditory or balance symptoms to your doctor, especially if you're taking medications known to be ototoxic. Diagnosing ototoxicity involves a thorough medical history, including a detailed review of all medications and past medical conditions. Audiological testing is essential, including pure tone audiometry to assess hearing thresholds at different frequencies, and otoacoustic emissions, OACE testing to evaluate the function of the outer hair cells in the cochlea. Vestibular testing, such as video nystagmography of Vienne, may also be performed to assess balance function. Early detection is key to potentially minimizing the damage. While ototoxicity itself isn't classified into distinct types in the same way as other diseases, the damage it causes can manifest in various ways. It can primarily affect hearing, primarily affect balance, or affect both. The severity of the damage can range from mild, temporary hearing loss to profound, permanent deafness and debilitating balance disorders. The pattern of hearing loss, whether it affects specific frequencies or is more generalized, can also vary depending on the causative agent. Unfortunately, there's no cure for ototoxicity once the damage to the inner ear has occurred. Treatment focuses on managing the symptoms and preventing further damage. This may involve discontinuing the ototoxic medication, if possible and medically safe. Hearing aids can help improve hearing for those with hearing loss. Vestibular rehabilitation therapy can help improve balance and reduce vertigo. In severe cases, cochlear implants may be an option for restoring hearing. Supportive therapies, such as counseling and support groups, can also be beneficial in coping with the emotional and psychological impact of hearing loss and balance problems. Prevention is the most effective strategy against ototoxicity. When prescribed potentially ototoxic medications, discuss the risks and benefits with your doctor. Ask about alternative medications, if available. If ototoxic drugs are necessary, ensure regular monitoring of hearing and balance function, especially for high-risk individuals. Staying hydrated, avoiding loud noise exposure, and maintaining good kidney function can also help reduce the risk. Never take medications without consulting a healthcare professional. The prognosis for ototoxicity depends on the severity of the damage, the causative agent, and how quickly the condition is diagnosed and managed. While some individuals may experience only mild, temporary symptoms, others may suffer permanent hearing loss and balance problems that significantly impact their quality of life. Recent research is exploring potential preventative measures, such as using antioxidants or other protective agents to mitigate the damaging effects of ototoxic drugs. Gene therapy and stem cell therapy are also being investigated as potential future treatments for reversing hearing loss caused by ototoxicity. Ongoing research provides hope for better treatments and preventative strategies in the years to come.